Good morning, good afternoon, and good evening to everyone. My name is Joanne Pasek, and I am the founder and medical tourism facilitator at GHW Medical Tourism Incorporation. I would like to greet you all good day. And I don't know where you are watching right now or listening, and the time zone difference, it doesn't matter, but I want to greet you all happy, good day. Just generalize. Today, I want to talk about dental, dental tourism in Thailand, and I am collaborating with Bangkok Dental Center, and they have other location as well in Phuket and Chiang Mai. But the one that I will focus on is the one in Bangkok because it catered most in international patients, international clients. And why is that? The purpose of the dental hospital or dental clinic, it's because it's situated in the capital, which is Bangkok, and where is the hospital they have more of the diagnostic test or lab that they are going to do, and most of all, it is a very convenient location. And the other location that I mentioned in Phuket, it's mainly catered to backpackers or any travelers that want to have a dental procedure very light, meaning not major dental works in comparison in Bangkok branch or Bangkok location. And the other area or location, it's in Chiang Mai, which is catered mostly to retirees because that area, that community, where are the retirees, you know, mingled, or they choose that area in Chiang Mai. But as we all knew that there are certain months of the year that Chiang Mai sometimes it's not good to some extent when it's harvesting season or season when they have to start burning. I guess I will show you some link regarding about that part of farming location or farming areas. Now back to Bangkok. How are you gonna deal with dental procedure? As we all know that it depends to the procedure. It depends to individual choices if they want to have major or minor dental works. Let's say if it's only for cleaning, only for fillings, that you can do it for 2 weeks. If you have a 2 weeks vacation or 2 weeks vacation in Thailand, then at the same time you can do your dental works or dental procedure. Now, when it comes to other issues, you can do that in a period of 2 weeks. Let's say if you have a vacation for 2 weeks, you can do that in 2 weeks, but it's just like a preliminary, or it's like a just to get on and have an idea what do you want to do with your teeth. By that 2 weeks, you just want to try the or do fillings and cleaning, and then that's also another way of doing another test, another like lab work, let's say x-ray or anything more thorough if you want something to have a root canal or anything you want to crowning. So those are a little bit longer stay. I prefer that. I will have to tell you honestly that it will be a bit longer stay, just to make sure that the the fitting and any side effects. I have to include side effects because individual is different, right? And you have to be aware of that. So even if you're gonna do it in your country where you're at, there's always a post treatment that you have to follow, or you have to be aware. Let's say if your body reacts into something, or if you did something and then that's you have changes, right? So that's what I meant about side effect. Now, when it comes to prior to your flight, let's say if you start in Canada, or if you start from the States, or if you start from, let's say, Australia, so there's a free consultation directly to the clinic, the BDC. And that consultation can be done Zoom, or any sort of method via online video. Okay, so that's the consultation for, let's say, if you want to have your teeth picture, taken, or do you want to look at it. Okay, and you can send that information directly to the BDC, directly to the dental hospital or dental clinic, and together with the doctor or the consultant that you are dealing with. Okay, from the beginning down to the last procedure. Because for me, or for us here at GHW, a Medical Tourism Incorporation, we are there for you as well from the very beginning of what you're going to be doing and what is the proper way to do it. We can set you with a consultant, or we can set you with other staff. Okay, accommodation, there's an accommodation, but if you want to do your accommodation, and we can handle that, we can work on too. And if you want a personal carer, the personal nurse, we can handle too, if that's what you want in your plan. And that's also what you want to put in your budget, if you want to set aside a budget for that, so we can help you, because this is customized. Okay, the global health and wellness medical tourism, it's not like we set a package. There is already a package where the medical or the clinic or the hospital, they have the package. But for us here, we cater to what you need. We cater to what your budget is, and the length of your stay, the length that you're going to be there in that foreign country, in the destination where you're going to do your dental works or dental procedure. So that's how I handled with the client or the patient. Now back to the free treatment. So before you fly, obviously you're gonna have a consultation to the clinic, dental clinic, or the dental hospital, and discuss what do you want to do with your teeth, right? What's your goal? What's your dream? Then they're gonna help you. They want to execute it. Okay, and depending on your budget, depending also your stay, because that's very crucial, the budget and the time that you're going to be there. Because if you have 2 to 3 weeks, be mindful as well that what you want to do, what you want to achieve. The dental clinic and the dental hospital have something to say. They will do an assessment, and they will have to present it to you that this is the approximately time that you're gonna be need to be there.